EMT Cadenhead. Got a call for a patient who was hit from pedal cycle and is unresponsive. DSI to include face mask, gown, and goggles. Scene is safe. Mechanism of injury. Motor hit from pedal cycle and unresponsive. Number of patient 1. Do I need additional help? Yes, I'm going to request ALS support and I'm going to consider spinal mobilization. So, general impression, female patient, seemed to be in her early 30s, found to be unresponsive in the supine position. I'm now going to check her level of consciousness. I'm going to approach my patient in the line of vision. I'm going to ask her not to move her head. Ma'am, if you can hear me, don't move your head. Okay. I'm going to manually stabilize her C-spine and ask my partner to come and manually stabilize it for me. Okay. At this point, I'm gonna apply painful stimuli to the orbital nerve. Alright, my patient groaned, so she's responsive to pain. I'm now gonna check her breathing and circulation. I'm gonna assess her breathing for rate, rhythm, quality, and depth. I'm gonna ask my partner to open the airway with the jaw thrust maneuver because it's a suspected spinal injury and we don't want to use a head tilting lift. Alright, so airway is open and patent. I'm going to check for breathing, look, listen, and feel. At the same time, I'm going to assess the rate of breathing, quality, and depth. I'm going to do that for 15 seconds and multiply by 4. I get a breathing rate of 22 breaths per minute with adequate rise and fall, adequate depth. I'm now going to auscultate at the apex, both apices, base of the lung in the mid axillary region. I'm hearing some abnormal sounds. I'm now going to check circulation. However, due to the fact that I'm hearing abnormal sounds, I'm going to apply the pulse ox to get a reading, a pulse sat reading, so as to apply oxygen. So I'm going to apply the pulse ox. I'm getting a sat reading of 88%. So we're gonna give this patient some oxygen via non-rebreather mask at 12 liters per minute. Okay. Alright. Now I'm going to go into circulation. I'm going to assess radial pulse for rate, quality, rhythm, I'm going to do this for 15 seconds, multiply by 4. Alright, my patient have a pulse reading of 84. Pulse reading of 84 beats per minute with bounding and regular. Alright, at this time I'm going to expose my patient and do a rapid scan. I'm going to begin with the head. I'm going to check for ECAP BTLS. DCAP BTLS. I'm going to look in the ear and nose for cerebrospinal fluid. I'm going to check the neck for jugular vein distension and tracheal deviation. Also subcutaneous emphysema. None is present, so I'm gonna apply a C-collar. I'm then gonna palpate the shoulders, the clavicle, the thoracic region, the abdomen, all 4 quadrants, both upper extremities. I'm going to also palpate the pubic area. I'm going to palpate inward and downward, the thighs. Both lower extremities. Observe fracture to tib fib. I'm going to ask my other partner to come and manually stabilize this while I check for a pulse. Dorsal pedis, due to the fact that this patient is unresponsive, I will not check motor function. Okay. I'm now going to apply a splint. And then now we're going to log roll this patient and secure her to a backboard. And we're going to do this on the uninjured side. My partner is going to count. After 3.
1,
2,
3.
3. Okay. Alright, I'm gonna assess patient's posterior for any major bleedings or any other injuries. Found laceration, patient's back. I'm gonna clean and cover, and then we're gonna secure the patient, lower the patient to the backboard and secure patient. After 3, 1, 2, 3. Alright, so patient is on the backboard. This patient is a load and go patient. I'm gonna transport this patient to the hospital. I'm gonna ask my partner to do a set of baseline vital signs, and we're gonna reassess this patient every 5 minutes due to the nature of the illness. So while en route, we'll communicate with the receiving hospital the condition of this patient,